Our biggest fear when the pandemic started was how were we going to keep our Vincentian volunteers and the neighbors in need who they serve safe. We were worried that we weren't going to be able to offer the direct person-to-person service that the Society of St. Vincent de Paul prides itself in.
Well, when the pandemic first hit, our biggest concern was food insecurity. For so many of our clients who were coming to the senior center, they didn't have access to the meal there, and they didn't have access to food shopping through our buses. Then it became an issue that they couldn't wait in line and they couldn't have food delivered, either because not comfortable on the computer or that just wasn't available as it was a challenging time. But once the food insecurity issue resolved itself over time, the next big crisis became loneliness, isolation, and real hopelessness amongst our seniors.
When COVID first hit, the concern was how do we pivot quickly to continue to meet the needs of our clients without missing a beat? And we did that through telehealth and redeploying everyone to work remotely, quickly obtaining computers, laptops, whatever was needed to accommodate our staff so they could serve our clients.
My greatest concern was losing face with the communities that we serve and that rely on us.
The hallmark of our ministry is the home visit, where Vincentian volunteers meet neighbors in their homes, making them most comfortable and treating them with the dignity and respect they deserve. How are we going to do this if we had a stay-at-home order where person-to-person contact was limited? What we found was that our Vincentian volunteers were able to adapt and utilize technology like three-way conference calling, FaceTime, and Zoom communications. They use this technology to maintain the face-to-face interactions that's so important when having neighbors in need feel comfortable, respected, and dignified.
Well, in the past, prior to COVID, we would have developed a rapport with the client by holding their hand, having face-to-face eye contact, giving a hug if they were particularly down, but we've had to step away from that. And now that connection has to be through common history, common background, and really in a relationship over the phone, trying to find similarities and connections that they feel comfortable with you and know that we're here to support them and help them through this process.
Well, we continued along that path for the entire year, working remotely, initially almost exclusively, except for our 24/7 program, such as shelters and our DASH program, the crisis stabilization. But everything else, we worked remotely pretty much all week until last summer, and then we started to bring staff back and do more of a hybrid schedule of remote some days and in the office others, and we did it specifically so we wouldn't have a large volume of people in any one building.
Since last year, just about every organization has had to rethink and restructure its strategies moving forward. And so something that I did last year in 2020 to meet the new needs was to get certified as a navigator by the New York State Department of Health. And with this certification, I was able to join our health access team here at Health and Welfare Council of Long Island and help enroll Long Islanders in the right plans for them.
The biggest changes in our processes was probably around communication. We started using social media more frequently and effectively and offered twice weekly email communications to our Vincentian volunteers.
Well, because of the pandemic, we have not been doing home visits with our case management clients. And as a result, we are serving a far greater caseload because we don't have the travel time that's impacting their day. So they are serving more clients as a result. It has had to change what we did so we don't have the home visit, but at the same time, we are getting clients on services immediately as opposed to any type of wait list.
A combination of doing in-person and telehealth has really helped to continue to see that our clients got served.
One of the programs that Health and Welfare Council has had to completely change and rethink is our VITA program. In years past, we usually had staff members located at various sites across Long Island, to help schedule and assist patrons with completing their tax returns. Now, due to COVID-19 and due to the incredible leadership of our program managers, we've been able to offer this VITA service completely virtually. So I think as a result, that has been beneficial in serving the greater part of Long Island, making it more accessible and easy to use for everybody.
The highlight story for me during this pandemic was one about an immigrant family who had been in this country for several years working in the restaurant industry. They asked for some help with tuition for their child's community college payment. Because they didn't receive any government assistance, the neighbors were able to be connected to immigrant resources for food and clothing, which would allow them to use some of their other financial resources toward the tuition and continue the dream of their child's college education.
One success story I would like to highlight is our Wantagh Senior Center. They were hearing from the clients how lonely and hopeless they were, and they created a program of words of encouragement, is what they call it. And what they do is they share with homebound clients a program, a list of readings that they do in advance, and then they conduct a group call where they're helping each other. They're a support group for one another and really developing a relationship over the phone, something that we wouldn't have had to do prior to the pandemic, but has been so helpful for our clients.
A client I've heard of fairly recently was a couple who had a child about 8 years old. Both of them got COVID. The husband also simultaneously was being furloughed from his job. So this was a family that in total panic. They were referred to us by a friend of theirs who contacted us. And through other resources, through donations that we obtained from corporations and foundations and individual donors, we were able to help the family because they were worried about how are they going to they were living paycheck to paycheck. How are they going to keep their home? How are they going to get food? How are they going to continue to help their child feel safe? And FSL was able to meet those needs. We, send a staff person out. They dropped some food off and other supplies at their door. We were also able to help with rent arrears, again, doing this all through telephone and helping the family. And then at some point, we also did family counseling because their child was really very upset and concerned with his parents going to die. So a lot of work had to be done, but I'm happy to tell you at this point the child is doing fine. The parents both recovered well. The mother went back to work, and the father is still looking for work.
So a couple months ago, I received a call from a client looking to enroll in health insurance for herself and her family. I remember she was just a nice client. She had a great sense of humor, which stuck out. But as we're going through this application, I start to inquire about her year, asking her how 2020 had treated her and so on and so forth. And she said something along the lines of, we've all had a tough year. We've all had our ups and downs. But I'm still blessed. I'm still here. And I remember that stuck out specifically because it was until later on she revealed to me that in 2020, not only had she contracted COVID herself, she had lost her job. Her and her husband had been involved in an almost fatal accident, leaving them both temporarily disabled, which fortunately her children weren't involved in. But to top it all off, her husband had lost his job at the end of the year as well. So it was just a really, really poor, sour place for them to be. And I just remember, when we were able to enroll her in the in a health plan and get her enrolled in SNAP, she was just very gracious and she still maintained that sense of humor, throughout the whole process. And I just think that was quite astounding to be in a position like that, yet to always see the light at the end of the tunnel.